I'm Dr. Saumil Shah. I'm a plastic surgeon practicing in Borivali, West Mumbai. I'm the director of plastic surgery at Skinzone Aesthetics. And today in this video, we are going to learn about breast augmentation or increasing the size of your breasts without implants through fat grafting. So, fat grafting is a technique which in simple terms means we take fat out of one part of your body that you don't require and putting it into another part of your body that you want it to be. Fat grafting can be done into your breasts, into your buttocks. It can be done on your face instead of fillers. It can also be done for various other reasons such as some defects after some accidents or some other things. There are different types of these fat grafts that can be used even for sort of rejuvenation of the skin and improving the scars as well. So in this video, we'll basically be talking about fat grafting to the breasts. Now the first step in the fat grafting to the breasts is basically getting the fat from your body. How do we do this? We do this through a technique what is called as liposuction. In fat grafting to the breast, we basically do what is called as large volume transfer of fat. So in this case, we basically use the power assisted liposuction to take this fat out from any area that you feel that you want the fat to be taken out. Be it the lower tummy area, the inner thighs, the lower sort of thigh area, your arms, or any place of your body that you want the fat out of. However, the amount of fat that we require to put into your breast is very limited. So at one particular time, I don't think we take out more than 500 cc of fat per se, because we don't, at least I do not put in more than that amount of fat in both your breasts. There is a reason for this and I'll tell you this further in the video. So how do we do this fat grafting into your breasts? It's a very simple technique. We basically harvest this fat. This harvested fat is then in a canister, in a sterile canister that we have. It's a special canister that we can sterilize. The fat is then sort of washed with water so that the oil, the fat actual layer, and the other fluids such as fluids, impurities and blood separate out. We then sort of remove the impurities of the local anesthetic, the blood from your fat, and take the oil layer off from above. We then use only the fat in between to put it back into your breast. This is very important because the oil and the blood sort of decreases the viability. What we mean by viability is the survival of your fat. What we mean by the survival of your fat is that whatever we put into your body through fat transplant has to survive over there till blood supply again starts to this transplanted fat. During this time, there are many factors that decrease the chances of this fat surviving and for your results lasting. One of the things that decreases the viability of this fat is the blood and the local anesthetics that would be there in the fat. Now, what happens is that the body, the immune system of the body, sort of breaks this fat down and absorbs it. It does not cause any other issues, but this fat survival does not happen. As a result of this, it sort of reduces the results or decreases the results of fat grafting. So first we sort of process this fat. This is what is called as processing of the fat graft. So we process this fat. Then using syringes and tiny cannulas, we then inject this fat into your breast. These needles, so these cannulae, which are basically our hollow straw-like structures, are very thin of the range of less than 3 millimeters. So when we put it through very tiny holes that we create with needles, they don't leave marks after your surgery of any scars that are there post the fat grafting. We usually do the fat grafting in 2 layers only. This fat does not actually go into your breasts. We put this fat either in the layer of your fat that is right under your skin or under your breasts. So how we put the fat in is by using what are called as micro cannulas. These are very tiny cannulas which we sort of puncture using a needle. We make a hole, and through this needle hole we put these cannulas in and sort of put the fat right under your skin. So this does not leave any scars, so there are no scars after this surgery shown on your chest or on your breasts. Now the areas where we put fat is basically not right into your breast, but in two areas, which is right under your skin, which is called as the subcutaneous fat, and if we have enough fat, also deeper. The more superficial the fat is, the better the results will be seen. So that is why we prefer putting them right under your skin. We do not put them into your breast because this can damage the breast tissue itself and cause other complications which we don't want. So fat grafting to the breast is actually fat grafting over and under the breast. We mainly use fat grafting to give you sort of heavier breasts, to get a better cleavage, a fuller upper part of your breast, what we call as the upper pole of the breast. The results of fat grafting instead of a breast implant are very different. So there will be some patients in whom we will say, of course, they will only benefit from an implant. Or if you are a patient who is looking for a lot of projection of the breast, then you will definitely need an implant. But if you're a patient who's looking for maybe heavier breasts, a better cleavage, a fuller upper pole, then yes, fat grafting is a treatment that we can do for you. So fat grafting by itself is a one-time procedure, so it does not have sessions as such. However, we tell all our patients that about 30% of the fat that we put in is reabsorbed into your body, as a result of which you will lose a lot of the results that we give you. We cannot put in too much fat, because if we put in too much fat, under that pressure a lot more fat will be absorbed. So instead of 30%, you would lose 50% and the results would be even less. So we cannot overdo your grafting at one single go. So that is why, if you remember, I told you earlier in the video, we take only a certain amount of fat from a particular area. We sort of about 150 to 200 cc or maybe even 250 to 300 cc is the maximum that we go during one sitting. After that, if a patient requires and feels that she wants even more fat, then we wait for 3 months, because by 3 months usually whatever fat is to be absorbed is absorbed by your body. We then again redo this fat grafting, the same procedure. It can be again done through a similar process, and the remaining fat that is there in a particular area can be harvested, or we can take fat from any other area if you like, and we do this fat grafting again. This can be done for how many ever number of times you wish or you desire to get that particular size. But again, as I said, because fat is a softer structure compared to an implant, no matter how much fat we put in, we are not going to get the projection. We'll make the breasts heavier, we'll make them more shapely, but we can't get the projection. So fat grafting to the breast, though a single time procedure, usually we tell women that they might need to do it twice or thrice to get the desired results, and there are specific individuals in whom these will give great results, but there are some patients in whom you absolutely require an implant. So to know if you are the right candidate for fat grafting, so you will need to meet a plastic surgeon and understand the results that you may get post this surgery. If you have any other questions regarding fat grafting to the breast or to any other area, or any other questions regarding cosmetic plastic surgery, do let us know. And remember, get these surgeries done only by a plastic surgeon and not from anyone else.